In Virginia, the General Assembly approved the expansion of Medicaid to start effective January 1, 2019. Prior to that, the local departments were given resources and policy and instruction to give individuals access to apply for Medicaid beginning in November, so that the 30 to 45 days that local agencies have to approve individuals could happen so that it could start effective January 1 and there was no delay in the coverage.
Since Virginia expanded its Medicaid program in the Commonwealth, over 300,000 adults have been able to get care as of mid-August, and just under 4,000 of those live in James City County, York County, and the city of Williamsburg. So we're really excited for the number of people in our communities that are able to access care now because of Medicaid expansion.
A lot of my families are working families. Those are the people that have been able to get the insurance with the Medicaid expansion. And they may have been offered insurance through their work, but either the premium was too high, or they didn't go because they didn't have money for a deductible, or just even the copay. So it's the families that you see out and about in the community. Those are the people that are now eligible for the Medicaid expansion and are now able to get the health care that they need.
I do have a mother that had a blood clot disorder, and she was unable to get her medications for that because she knew they were too expensive. She no longer had insurance, and now because of the Medicaid expansion, she's able to get her medicines and continue care with that. Also, I have a mother that had breast cancer. She was in remission for a while, but still needed a lot of the checkups, and due to the Medicaid expansion, she's back to having her mammograms annually.
I was able to get a PCP through the Medicaid expansion. And then I was able to go to the ear, nose, and throat doctor and the neurologist. And I found out that I'm allergic to gluten and soy and yeast. I found out all these things, and that was playing a big part in my migraines. And then I was able to get maintenance meds. So I'm more capable and so much happier because I can actually get out and do the stuff I want to do.
I have not received care before this came to be. It was about 4 years. I had no care whatsoever. When we got it, things got better for us. I was diagnosed with depression and stuff like that. I didn't want to do anything. And when I finally got the Medicaid, I was able to get the help that I needed and the energy to do the things that I needed to do. Because we want to be able to do things for our kids. And now we're able to go out hiking and swimming and just enjoying life.
You have a healthier community, I think, with this, instead of just back at trying to resolve emergency situations. And those hospital bills can be really, really expensive, as we all know, going to an ER visit opposed to going to a primary care physician. So it allows people to have that holistic health approach and be able to see a doctor when they're ill and not wait till the last minute and where it is a real emergency situation.
Riverside's mission is to care for others as we would care for those we love. So we've been caring for these patients in our communities regardless of their ability to pay. But what Medicaid expansion has allowed us to do is to get reimbursed for those services that we were providing so we can reinvest that reimbursement back into our communities to even better care for the patients.
When individuals are able to receive the care that they need, there's less incidence usually of a ripple effect of other needs. And so, what we see in our work is if the physical health and the mental health is being addressed, then it kind of lays the foundation for them to be able to address things like employment and housing stability.
If the parent, grandparent, whoever it is taking care of the children, if they feel better, then they have greater energy to take care of their children. So the children are sick less, so the children get to school more, they're able to participate in outside activities. It just creates a more vibrant community for everybody.